If you wake up in the morning and as soon as you step down the bed, you get a sharp stabbing pain in your heel region, high chances you're suffering from a condition plantar fasciitis. Especially if it starts reducing, the pain starts reducing once you just start walking and take a few steps. It almost locks in the diagnosis, and you are probably suffering from this condition, which is globally the most common cause of heel pain or foot pain, I would say, most cases. And we are going to talk in detail about what is plantar fasciitis, why does it occur, why does it present as pain in the morning specifically, and lot more, including the treatment options. Why am I speaking about it? I am Dr. Varugurmani, a board equivalent certified interventional radiologist from India, and we treat a lot of these conditions, especially with minimally invasive techniques like lasers and angiographies. There is a whole revolution going on in the musculoskeletal field where today we have options even for the worst refractory recurrent plantar fasciitis, which we did not have earlier, and we'll touch upon that too. But right now I want to educate you about this condition, and in the last we will talk about that revolutionary angiography based option. So stay tuned. What is plantar fasciitis? Plantar fascia is a connective tissue which is on the base of your foot, which goes on from the heel till the toes, and it plays many roles in your foot. Right from supporting the plantar arch, the foot arch, to acting as a shock absorber most of the times while you're running, walking, even distribution of your body weight across all the three pressure points. So it has a very, very vital role. Unfortunately, when there is repeated wear and tear, you are overweight, there is improper footwear selection, and similar other causes, it can get irritated, inflamed, and there can be micro tears that develop in it, which start causing this pain. Many of you ask us why it's specifically in the morning when we put our foot down the bed and then why it starts reducing. Well, as you sleep, your foot relaxes, connective tissues, ligaments, muscles, supporting structures relax, the plantar fascia is tightened, the micro tears start healing overnight because you're resting, not causing more wear and tear. But when you get up and you suddenly put all the body weight on the foot, it stretches further and the tears redevelop, and then that causes a sharp stabbing pain. As you walk, the plantar fascia loosens, it gets a lot of support from ancillary structures, movement, muscles, connective tissue, and then the pain reduces. But yes, some cases, despite all managements, it can get worse with time and start occurring not only in the morning but throughout the day, and then it becomes hellish, and we need to talk about that. So who are prone for this condition? Well, practically runners or athletes are prone for it, but on the contrary, even people who stand or sit for throughout the day for their ergonomic profession, they are also prone to it. Overweight people, people with wrong footwear are definitely triggers that can do it despite not having ergonomic issues. But practically speaking, a major part of the world does have it, a significant proportion, and it is very, very common than we know. On examination, you can feel the tenderness on the heel. And just a point of caution, if you are doing an X-ray for this and you see a heel spur, a bony outgrowth, don't assume that that is the cause of your pain. Most of the times that's an innocent bystander thing that you see. There are so many patients with heel spurs and no pain or plantar fasciitis. There are so many patients with plantar fasciitis, no heel spur and pain. So mostly the culprit is the plantar fascia inflammation, which you will not see in the X-ray, which may be detected in a sonography or MRI, not in the X-ray for sure. What is the treatment? Well, initial stages, luckily most cases, they can heal with conservative management for 4 to 6 weeks, starting with ice therapy intermittently 10 to 15 minutes twice a day to cool down the inflammation, especially acute stage. Do rest and activity modification, which the orthopedic will guide you for. Getting some weight loss helps definitely. Better footwear, orthotopic inserts, all these conservative managements help. But if it's not resolving, then you can meet a rehab specialist who can help you with physiotherapy, with shockwave therapy, and occasionally steroid injections by an orthopedic or intervention radiologist or pain management specialist, depending on who's doing it in your area. Now, coming to those refractory or recurrent cases where it's gone beyond weeks, sometimes beyond months, and the pain is not subsiding, getting worse, has made your life difficult, what do we do in those cases? Earlier, probably the only option in such extreme cases was surgery. But that did lead to some instability, moving the plantar fascia or most of it, the tone part. Today, we have a novel technique known as plantar fasciitis embolization, or TAME, transarterial musculoskeletal embolization, which is a Japanese scientist and doctor research technique, Dr. E.G. Okuno invented technique, I would say, where we have found a way to enter the blood vessels of these plantar fascia supply the arteries through angiography through a very tiny pinhole, 4 French 1.1 millimeters, take a tiny microcatheter there, inject a particular agent, imipenem cilastatin, which is an antibiotic but has many different properties like anti-inflammatory action and only harms the inflamed tissue by reducing the blood supply, reducing the inflammatory markers or mediators that are going there and causing the micro tears and the inflammation, and it makes a lot of difference. Japanese data, American data, European data, and now EN data shows that the results are nearly 95 to 99% plus. Complication risk nearly zero. I would say zero practically. And if done in good hands, of course. Otherwise, unrelated complications are definitely possible. And even after 2 years to 5 years follow-up, the results are sustained in most cases. I would say 85 to 90% plus. That revolutionary technique. And good thing is, doesn't require admission, doesn't require anesthesia. You can go home after 4 hours. It's done without any blade, without any suture, without any scar. Everything through a pinhole and under X-ray guidance, navigating your tiny microcatheter 1.98 French 0.4 millimeters into the blood vessel, supplying the plantar fascia and knocking off. That beautiful a technique. And yes, I know sometimes things that sound too good to be true are always eyed with suspicion, but this is one exception where it is too good to be true even practically. So ending the video on this note, sharing few ancillary videos if you're interested in seeing other techniques that we do. Don't forget to subscribe because we are going to give you a lot of minimally invasive options. Stay safe, stay empowered.